Lexi is having a upper cervical issue, which she also has right TMJ subluxation, and so that also can lead into shoulder, which I'm going to get into on another video series. But today what I'm going to show you is the TMJ adjustment, the occiput adjustment, and we could also do the shoulder because that does intimately relate with that. So what I want to show you is when someone has a problem with TMJ or occiput, the problem can come from either one. They can also create problems down into the shoulder. So I'm going to show you how to do that. I'm going to show you how to analyze it. I'm not going to go over like details of where my hands are, but if you know how to manipulate, you're going to really get the gist of it, and you're going to be able to do it also. Okay, so Lexi, open your jaw. So if you look at it, her jaw deviates from midline and goes to the right. 90% of the time, that is going to be either a right TMJ problem or it's going to be an occiput problem. So looking at occiput, it does feel like her upper neck and occiput on the right is stuck. So just because TMJ is very sensitive, I'm going to adjust the right occiput first. So what I'm going to do is I'm going to put her head in a lateral position, and then I'm going to do almost a occiput lift, but it's more of like a hybrid, which I can teach you that in the seminar. It's not very good for like a video session. So what I'm doing is I'm just motioning it just to see if that is definitely what's out, and it absolutely is. So what I'm gonna do is I'm gonna support her head like this, and then I'm gonna go here, I'm gonna put this here, and then I'm going to adjust that occiput. All right, so what I'm gonna do is I'm gonna adjust this joint. It's going to be where I'm gonna stabilize here, and then I'm going to then thrust this way. So it's really going to be in line with, not necessarily, it's like a lateral, almost like an atlas adjustment, but no. So we'll go here. Okay. That moved beautifully. So what you want to do is you want to post-check your adjustments, and so now that area is absolutely moving a lot better. There's still, now I can feel a little bit of tension in her lower neck, which I'm not going to address right now. And then what I'm going to do now is I'm going to recheck her TMJ. I'm just not going to go straight into the TMJ adjustment and adjust it, because sometimes it doesn't need to be adjusted after that cervical adjustment or that occiput adjustment. Go and open the jaw. And it does, it's definitely out. So what I'll do here is, Lexi, I'm gonna have you lay facing that way. And so you do not have to have an elevated piece. You do not have to have a drop piece. I'm going to use that today. It is more comfortable for the patient and the doctor. What I'm gonna do is you're gonna see this pop up. It's just a lot more significant for the patient. Okay, so what I'm going to do, I'm going to put my hand on the TMJ joint, and I'm going to get a line of drive that is going to go down her jawline, essentially. So, you okay with that? Okay, clench your teeth. You can get them to clench their teeth to see where that joint is. If it's confusing for any reason, go ahead and relax the jaw. Make sure your teeth are together, just don't clench. And so what I'm going to do is I'm going to support her head here, and then I'm going to get that line of drive and I'm gonna drop. So go ahead and lay face up. We're gonna recheck that adjustment. Go and open. That was awesome. So the jaw now lines up midline and opens evenly. So the TMJ joint is the only joint in the whole body that actually exits and then enters back into both of the joint spaces. So you want that to happen. It affects cranial nerves. It affects cranial nerves, and it also affects just neurology, musculature. It affects so much of those two things are not truly working. I didn't start working on TMJ until I had an employee that was had a massive jaw issue, and she just had migraines, and no one ever taught me this. I taught myself, and then I started learning more about it. But I've been able to help migraine patients, headache patients, TMJ patients, just general neck pain. You can make a massive difference in your patients' lives, period, hands down. by doing this. Okay, so I'm gonna recheck everything. Okay, so I'm feeling a little bit here, but we won't get into that. I don't think she needs that today, but that moved fantastic. Her jaw is moving better. The top of her skull is moving better. In other videos, we will get into other accessory problems that goes along with that. But for simplicity and time, what we did today was occiput and TMJ. So thank you so much. Check out our other videos. And then also we have seminars coming up and we'd love for you to attend.